Lesch-Nyhan syndrome is a genetic condition means it's in the DNA, and it's a problem with one of the enzymes our bodies need to break down waste products. And in this condition, that enzyme is either missing or it just doesn't work as well as it should. And because of that, our bodies have a difficult time processing waste products like it should, and we get a buildup of what's called uric acid. And having too much uric acid affects the kidneys and affects the brain, and it can affect your neurons as well. So this condition is really one that affects those three. It can affect behavior and movements in the kidneys. So with Lesch-Nyhan, there is no treatment for it, but being diagnosed early is a good thing because there are a lot of therapies and treatments that we can do to help the patient live as comfortably and as actively as possible. This is, however, a condition with a life expectancy under 20 years. And what happens is the kidneys just can't handle that level of uric acid anymore, and they end up shutting down. Some things to expect with this disease: like I said, it affects the movement and behavior. So you might see some developmental delays, troubles reaching milestones, some intellectual problems. Typically, patients get around with wheelchairs for the rest of their lives. And down the road, one of the big things we look out for is they're called self-mutilation behaviors. It's where they'll maybe chew on their fingernails or bite their lip or bang their head against the wall. So that's an important thing we want to look out for, because they can really hurt themselves, and there are therapies and treatments we can do to help that. Some other things to expect down the road are some problems with kidneys, so building up kidney stones or possibly gout. That uric acid that builds up forms in the bladder. It can cause stones. It can also deposit in the joints, and that that makes gout. Because this is such a condition that affects so many different parts of the body, that we do have healthcare teams that can provide care starting now and moving forward, to help with symptoms and help your son live as comfortably as possible. And those teams can include therapists for the movement, speech therapy for talking and swallowing, kidney doctors, urologists, which also there's the kidney and bladder for stones, and then neurologists for the movement. So we can get set up with those, and a couple of things to look out for with the movement. Swallowing can be an issue, so we want to make sure there's no aspiration.